Katie Baca with BSN346, and I am doing the Healthy Education Prenatal video. So for appointments, to start off, your initial appointment will typically occur within the first trimester, and they will be every 4 weeks up until week 28. And then from there, it will be every 2 weeks up until week 36. And then from there, it will be every week up until delivery. The first appointment will last longer than the others because they're going to go into a lot more detail with you. They're going to want to discuss your medical history, family history, surgical history, past pregnancies, any medications you take, risk factors, and estimate your due date. And at that first appointment, they're also going to measure your height and weight. They're going to do your vital signs. Blood pressure is extremely important to monitor during pregnancy. They're going to want to do a urinalysis, pap and pelvic exam, and an ultrasound, which could be a transvaginal or an abdominal, depending on how far along you are. Starting at 10 weeks, they can use the fetal Doppler to start checking the baby's heartbeat, and they will start measuring your fundal height. At 20 weeks, you will get your second ultrasound, which is the anatomy scan, and you can also determine the sex of your baby at that time. At the appointments, 28 through 36 weeks, the bi-weekly, you will have your routine assessments, which will be the vital signs, the urinalysis, and the weight. But they also are going to want to check your gestational diabetes with a 1-hour glucose tolerance test. They're going to administer a Tdap vaccine, and you're going to receive the RhoGAM injection if you are Rh negative. At your 36-week and beyond weekly appointments, they're going to again do your routine assessments, which include your vitals, your analysis, and weight. But they are also going to want to start checking the position of the baby. They're going to start checking your cervix. They are going to swab you for group B strep. And then they're going to educate you on contractions, true versus false labor, warning signs, and what to do if your water breaks. Now, to go into a little more depth with other labs and assessments that you'll be doing, so again, you have the 2 ultrasounds, but you will. It is possible you may have more ultrasounds. It just depends on your pregnancy. Some labs that they may want to check you would be your complete blood count, your HCG levels, your blood type, and Rh factor. They may do a urine culture. They are going to check you for HIV and syphilis, and check your immunity to varicella and rubella. There are also 5 genetic tests that you can choose to do, 3 of which are blood tests. There are 2 blood tests for Down syndrome, which are the NIPT and the quad test. The 3rd blood test is checking for neural tube defects, and that is the AFP. The other 2 tests are considered invasive, and they are the amniocentesis and the CVS. Next up, we're going to talk about nutrition. You'll want to increase your calorie intake by 300 calories per day while pregnant. And that's going to be with a good diet with protein, fruits and vegetables, and whole grains. So all fruits and vegetables, if they're fresh, you want to ensure that they are washed, and you want to avoid sugary and fatty foods. Now, there are some vegetables that you can get good amounts of potassium and vitamin A, and those include sweet potatoes, carrots, and spinach. Some good fruits that contain good amounts of potassium and vitamin C are cantaloupe, bananas, and oranges. You'll want to also get good amounts of calcium and vitamin D, and this will also contain potassium and vitamin A, and that's going to be the low-fat or non-fat yogurts and low-fat milk. As far as whole grains go, you'll want to consume ones that are high in iron and folic acid, and that would be like your ready-to-eat cereals, your cooked cereals, and iron-fortified breads. And then as far as protein goes, you can consume beans, peas, nuts, seeds, any protein powders that are safe during pregnancy. There are certain ones. Lean meats and fish such as salmon or trout. You do want to avoid unpasteurized milk or cheese, hot dogs, deli meat, and any undercooked meat or seafood or eggs. And you do not want to eat any raw fish. That is a big no-no during pregnancy. And as far as water goes, you do want to make sure that you are drinking 8 to 10 cups of water per day. A good prenatal vitamin is going to contain 600 micrograms of folic acid per day. Folic acid is important for preventing neural tube defects, which is birth defect of the brain and spinal cord. A good prenatal vitamin should also contain omega-3 fatty acids, which are good for brain development, iron, which is good for preventing you from getting anemia, and vitamin D and calcium, which are good for bone and teeth health. Next, we want to talk about exercise. So a good exercise regimen is important during pregnancy. You'll want to get about 150 minutes per week of moderate intensity aerobic exercise. And this can be split up however you like. You could do 30 minutes 5 days per week, for example. Some exercises that are good during pregnancy are going to include walking, swimming, yoga, and Pilates. Exercises that you want to avoid are going to be any contact sports, anything where you might fall on your stomach, so like skiing, skating, horseback riding, and you also want to avoid exercises where you are flat on your back. Some good weight gain. We want to talk about weight gain. A good weight gain depends on your pre-pregnancy weight and BMI. So if you were considered underweight before pregnancy, such as that your BMI was less than 18.5, you're going to want to gain 28 to 40 pounds. If you were considered normal weight with a BMI of 18.5 to 24.9, you're going to want to gain 25 to 35 pounds. If you were considered overweight and your BMI was between 25 and 29.9, you're going to want to gain 15 to 25 pounds. And if your BMI is 30 or more, you are going to, and that's considered obese, you are going to want to gain 11 to 20 pounds. There are some common complaints with pregnancy, and those can include nausea and vomiting, stretch marks, and constipation. And there are ways to combat all of those. For nausea and vomiting, you can eat healthy snacks and small frequent meals, avoid spicy foods. Ginger candies and ginger ale can also help with that. And as far as stretch marks go, you'll want to use a pregnancy-safe lotion and vitamin E oil. You can put that on your breasts, your abdomen, your sides, and your upper legs. For constipation, you'll want to increase your fluid and fiber intake. Exercise is good to prevent constipation as well. And if you're still needing a little help, you can talk to your doctor about taking a stool softener such as Colace. Lastly, we are going to talk about warning signs that need immediate attention from your provider. The first one is going to be if you have any redness, heat, swelling, or pain of one leg, that could indicate a blood clot. Next up, if you have any persistent severe headaches, this could indicate preeclampsia. And lastly, if you have sudden severe abdominal pain, this can indicate that you have a placental abruption, which is when your placenta detaches from the uterus. So those are all emergencies. And thank you for your time.